exactly at 11. So it'll you just look at the clock and then start. Thanks.
Okay, I am now opening the room to journalists.
صح؟ ماشي انا باش تجيني قريب. الحل باش ما تقراش الديسكور، ما تمشيش تقرا الديسكور، انت تعرفني.
Hello, good morning. It is 11. My name is Elizabeth Kouaouvi. Welcome to the WHO Africa Media Briefing. This media briefing is taking place in collaboration with the APO group. And I would like, first of all, to give you some housekeeping information. You can choose the language you'd like to hear for the press conference by turning to the globe on the bottom right and selecting your language. Chers participants, chers membres du panel, Dr Moeti, je m'appelle Elisabeth Kouaouvi, je souhaite la bienvenue à cette conférence de presse de la région Afrique qui se tient en collaboration avec le groupe APO. Tout d'abord, pour quelques questions d'intendance, vous pouvez choisir la langue de votre choix en cliquant sur le petit globe que vous voyez en bas de votre écran. Vous avez le français, l'anglais et l'arabe. Donc, vous pouvez choisir la langue de votre choix dans laquelle vous voulez écouter cette conférence de presse. Joining us from Brazzaville, Republic of Congo, we have Dr. Moeti. Good morning, Dr. Moeti, WHO Regional Director for Africa. And we let Dr. Moeti introduce our other panelists. Dr. Moeti, you have the floor.
So good morning and good afternoon to all of our colleagues in the media participating in this press conference and to everyone who's watching online. Today, we'll be focusing on Africa's progress in rolling out the COVID-19 vaccines 100 days into 2021. I'm very pleased to be joined by Dr. Abdel Hakim Yayan, who is the
I think we lost Dr. Moeti. Dr. Moeti's sound is lost. Dr. Moeti, can you try to join the call again?
Yes, I think we had a
Hi, can you just confirm that
connection issue.
I'm audible?
Yes, Dr. Moeti, we lost the sound for a few seconds.
Okay, so I will go back and start from scratch in just saying hello to everybody and welcoming my fellow panelists. And again, a warm welcome to all our colleagues in the media and to everybody who is watching us online. As I was saying, we'll be focusing today on Africa's progress in rolling out the COVID-19 vaccines. We are 100 days into 2021. It's a great pleasure to welcome Dr. Abdel Hakim Yahyane, the Director of Population at Morocco's Ministry of Health. And just to note that Morocco has administered more COVID-19 vaccine doses than any other African country. And we'll be very happy to hear from Dr. Yayan how this impressive progress has been achieved. I'm also very pleased to be joined by and to welcome my colleague and dear brother, Mr. Mohamed Malik Fall, who is the UNICEF Regional Director for Eastern and Southern Africa. UNICEF, a key partner working with us through the COVAX facility to procure and ship vaccines to countries. And of course, we work together on other critical areas of health. There have now been around 4.3 million COVID-19 cases on the African continent, and 114,000 people have sadly died. For the past 2 months, we've seen a plateau of around 70,000 new cases, 75,000 new cases per week, with a slight decrease in cases in the past week of 6.7% compared to the previous 7 days. Kenya in particular is experiencing a third wave, and the epidemic is trending upwards in 14 other countries in Africa, including Ethiopia, Tunisia, Mali, Eritrea, and Rwanda. Vaccination is a life-saving tool in the response to the pandemic. And 100 days into the year, and of more than 600 million vaccine doses distributed globally, Africa has administered only 20%. More than 1 billion Africans remain on the margins of this historic march to end the pandemic. African countries like Ghana, Rwanda, and Angola have delivered a significant proportion of their vaccines within a short space of time. And some of the success factors there include training of staff in advance, simulation exercises, pre-listing priority groups, and communicating early with communities. Sensitization efforts, for example, have been key in managing vaccine hesitancy among older people, as well as vaccine eagerness among young people in the context of limited supplies. However, 10 African countries that have carried out the most vaccinations have now used up over 2/3 of the supplies that they've received. At the same time, countries such as Benin, Comoros, Liberia, Sierra Leone, and South Sudan have faced delays in rolling out vaccines due to constraints around funding, planning, and human resource shortages. So operational challenges related to limited preparation to target priority groups and insufficient micro-planning are providing lessons for subsequent rounds of vaccination. We're learning that early planning is imperative, along with proactive communication, ensuring that funds are available at the operational level, organized handling of data, and use of vaccination cards to track the doses administered, as well as any adverse events. As WHO, we're working with partners to support countries in addressing these challenges, including supporting their micro-planning, advocating for additional resources, putting in place effective communication strategies, and improving reporting of real-time data. Delays in COVAX shipments are expected to continue this month, unfortunately, as India is fighting a severe second wave of COVID-19 and has temporarily banned vaccine exports. Despite supply challenges, we're expecting COVAX deliveries in the coming weeks to Guinea-Bissau, Mauritania, Niger, Cameroon, and the Comoros. Countries that have been affected by the delays have received WHO guidance to optimize the national deployment of the available doses. And manufacturers, along with WHO, the Africa CDC, African countries, development partners, and the African Vaccine Manufacturing Initiative are working hard to sustainably scale up vaccine production. But we recognize that this cannot be achieved overnight. Short-term solutions are needed that prioritize vaccine equity. And Africa is already playing COVID-19 vaccination catch-up. While we acknowledge the immense burden placed by the global demand for vaccines, inequity can only worsen scarcity. So, I understand that people may be concerned by the European Medicines Agency announcement yesterday of a possible link between the Astrazeneca vaccine and unusual blood clots with low platelets. While concerning, the events under assessment are very rare, we'd like to emphasize. Almost 200 million individuals have received this vaccine around the world, and cases of blood clots and low platelets are extremely low, with less than 100 events reviewed in Europe. Nevertheless, this matter deserves close and continuous analysis, and WHO continues to gather and review data on this vaccine while carefully monitoring the rollout of all COVID-19 vaccines. And based on current information, WHO considers that the benefits of using the vaccine greatly outweigh the risks, and that countries in Africa should continue to vaccinate people with the AstraZeneca vaccine while we continue to analyze the data and to update through our expert committees the recommendations and advice to countries accordingly. Finally, yesterday was World Health Day, also known as WHO's birthday, and we celebrated by calling on everyone to contribute to building a fairer, healthier world. The COVID-19 pandemic has dramatically illustrated how important it is to address gaps and inequities in access to preventive interventions and good quality healthcare for everyone, everywhere. One of the clearest ways to progress towards fairness is by supporting equitable distribution of COVID-19 vaccines. This means ensuring that priority groups are first in line for vaccines at the national level and working together with international solidarity to ensure vaccines reach every country. I'd like to emphasize that this also means that countries that have got surplus doses, so mainly high-income countries, should act on their indication in the past in statements and share the vaccine supplies with other countries. It's only by doing this sharing that we will share the risks, that we will minimize the emergence of further variants, and that we will manifest global solidarity. So I thank you again for joining us for this conversation, and I very much look forward to our conversation with my fellow panelists and with the members of the media. Thank you.
Thank you so much, Dr. Moeti, for this update. Let me turn to Dr. Yahyan. Dr. Yahyan, est-ce que vous pouvez nous parler de l'expérience du déploiement des vaccins contre la COVID-19 au Maroc?
Merci. Merci, Madame la modératrice. Merci, Dr. Moeti. Pardon. Je remercie tout d'abord l'OMS pour l'invitation aujourd'hui à cette conférence de presse. Je remercie Monsieur le ministre de la Santé de m'avoir désigné pour participer avec vous à cette conférence. Je remercie aussi, un grand merci aux médias et à l'auditoire. Il est clair aujourd'hui que la pandémie due au Covid-19 reste toujours une menace pour la santé publique et aussi pour le développement Le commerce, les voyages et le tourisme ont été interrompus. Cela est mauvais pour toute l'économie et aussi le secteur social. La mise au point de vaccins contre le virus responsable en un temps record représente une lueur d'espoir pour le monde entier. Dans cette optique de vaccination, le Maroc a pu acquérir jusqu'à aujourd'hui plus de 8,5 millions de doses pour faire bénéficier 4 250 000 de ses citoyens en l'espace de 10 semaines. Dans un premier temps, il s'agit de la population âgée de plus de 60 ans et les personnels de première ligne. Puis, dans un second temps, la vaccination gratuite et non obligatoire sera étendue aux tranches d'âge de moins de 50 ans pour toucher approximativement 25 millions de citoyens et les étrangers résidant au Maroc. En application des hautes instructions royales, le ministère de la Santé a désigné un comité national scientifique pour l'élaboration de la stratégie vaccinale contre le SARS-CoV-2. Il y a eu aussi la désignation de comités thématiques relevant des directions centrales du ministère de la Santé et travaillant sur les aspects programmatiques, médicamenteux, logistique, communication et systèmes d'information, y compris la pharmacovigilance. L'implication des autorités et des secteurs publics et privés de santé a été un déterminant du succès. Aussi, il est à préciser que tout le dispositif est informatisé. Il suffit de fournir le numéro de carte d'identité et les rendez-vous vous sont envoyés par SMS. Au niveau de la station vaccinale ou centre de santé, l'équipe en place s'occupe de vérifier l'état de santé des gens et les piquer. L'Organisation mondiale de la santé a félicité sur Twitter le 3 mars le Maroc pour la réussite de la vaccination contre la COVID-19. Nous en sommes fiers. Depuis le début de la crise, alors, fil de mesures sanitaires de prévention, le Maroc aura la campagne de vaccination qui est l'approvisionnement. Je vous remercie pour votre attention.
Merci infiniment, docteur Yariane. Monsieur Mohamed Fall, please, Mr. Fall, can you tell us about how UNICEF is engaging with the communities to address vaccine hesitancy? As mentioned before by Dr. Moeti, we observed some vaccine hesitancy. Can you tell us about how UNICEF is addressing this issue? Thank you.
Thank you very much, Elizabeth. Allow me first to greet all the colleagues and partners from media who are gathering today with us. But I wanted also to start by thanking my sister, Dr. Moeti, for inviting us in this important press briefing. And of course, also greet the other panelists. We have just heard Dr. Abdelakim Yaya from Morocco. I see Dr. Abdusalam Gay, and I think this conversation is extremely important. Let me just highlight the fact that we are extremely proud of the partnership that has brought us here through the COVAX, which is the partnership we have with WHO, the partnership with Gavi, the partnership with so many partners, globally speaking, which make it possible to address this high concern we all had in the beginning, which was the issue of the vaccine equity. And through the rollout of COVAX, we are seeing now that vaccines is touching down almost everywhere in the world. And if I take just the case of the region that I'm leading, we have 21 countries in Eastern and Southern Africa. Close to 12 countries have already received their vaccines, and in the coming days, we know that Zambia, we know also that Comoros in the beginning of next week, as of Monday, 12th of April, will receive their vaccine. And as you know, also UNICEF has vaccine as its DNA. We have been procuring and managing through the enlarged program of immunization over 2 billion doses of vaccine every given year. And this is something which is an important milestone as Dr. Morti was saying, in terms of bringing equity into access to health and in saving life. And if we have really an important breakthrough in child survival in the past decade, it's thanks to this vaccines operation. Now with COVAX, this endeavor is going to be bigger because it's almost a double of the number of those that we will be committed to procure and to deliver in countries. And we are hopeful, and as we see the start of this operation, that we will be there. But as you know, vaccines has so many components. It's not a matter of just discovering it. It's not a matter of testing it. It's not a matter of procuring it and making it land in the countries. But the most important part is also making sure that it reaches everyone's arm and it also meet the acceptance of everyone. It's true that we are facing hesitancy, we are facing misinformation, we are facing rumor, but I just want to say and reassure all the public that this is not something new or something linked to COVAX. We have seen it throughout the enlarged program of vaccination. I was a representative in Nigeria, where we struggled for years to eradicate poliomyelitis. And last year, we have gone through an important milestone in sub-Saharan Africa by eliminating the wild virus of polio in the continent, which to me was extremely important and which also was done through effort of different partners that I have mentioned here, but which was done also through the way we address the hesitancy, the way we address the misinformation, the way we address the rumor. And I just wanted to say that this is where we are today. It is there. But what we see is that in general, based on all the data and information we are collecting, the overwhelming majority of the population accepts the vaccines. We still face pocket, we still face hotspot where hesitancy is there, where misinformation is circulating. But building on our long-standing experience of working on vaccination and addressing this rumor, misinformation, and hesitancy, we are hopeful that also we will get through this important endeavor. And we have seen it now with the high level of acceptance among the health workers who are in the priority group for the first phase of the rollout of the COVAX. We are seeing it in the frontline workers. Yes, as I said earlier, there are still some pockets, there are still some groups or minorities that are resisting, but hopefully building on this experience, but not working also only with the partner that I have mentioned. Also, we have tradition of mobilizing traditional leaders. We have tradition of mobilizing influencers. We have tradition of mobilizing government, civil society, and all of us in hand on trying to address this. That's what we see, and that's what we start unfolding also, and that is what is making the progress that we have heard in countries like Morocco, in countries like Rwanda, like Angola, which are now rolling out to a level which is quite satisfactory. The COVAX and the number of dose of vaccine that they have received. Maybe I will keep it there and just wait for more questions. Back to you, Elizabeth.
Thank you very much, Mr. Fall, for this comprehensive answer. Now that we have heard from all our panelists, it's the time for the media to ask questions. To do this, kindly, ladies and gentlemen from the media, kindly use the question and answer function in the Zoom application. And please remember that you have to provide your name, the news organization you represent, and you please ask only one question per journalist because of the volume of questions you receive. If we have time, we may take another question, but kindly ask one question at a time. And indicate if you would like to ask your question live or you would like your question to be read. We have with us some high-level panelists. So we have Dr. Salam Gay, Regional Emergency Director for WHO in Africa. We also have with us Dr. Richard Mihigo, Immunization and Vaccine Development Program Coordinator in WHO Africa. So let me ask the first question. It's from Mr. Isiar. Isiar, are you online? Are you on the call? Please unmute yourself and ask your question. So there's, maybe I can read the question if it's not live so that we can save time. It's a question from Isia from El Diario. So let me read the question. I would like to know if the WHO is concerned about the impact of the latest news about the Astrazeneca's vaccine and about the confidence in this jab in the region. Let me turn first to Dr. Moeti.
Yes, thank you. Thank you very much, Isia, for that question. As I said in my statement, of course, we would be concerned about any adverse effect of a vaccine or a medicine on the population, both in terms of concern about health and very importantly as well in terms of concern about impact in confidence in this tool. And we have had the European Medicines Agency, as well as currently an expert group in WHO, continuously examining the data about this, this manifestation of blood clots with low platelet counts in some of the people that have had this vaccine administered. So I'd just like to emphasize how very few people this is compared to those that have received the vaccine. So over 200 million people have received the vaccine, and about between 100 and 200 cases of this manifestation has been found. So it is an extremely rare event. And the East African, the European Medicines Agency has indicated that there is some indication that this may be causative, but they still have to look at additional data to confirm this causal relationship. So overall, while we are noting this potential adverse effect, and we are investing effort with our experts, with our partners in continuing to analyze the data, as WHO, we are recommending, and we'd like people to know that we continue to recommend the use of this vaccine and indicate that the benefits of using this vaccine, if we look at the millions of people that have died of COVID-19 compared to those that have been vaccinated, and a very tiny number that have manifested this the side effect, we will continue to recommend its use. We will analyze the data. We would particularly like to analyze the data in Africa because, of course, some of the precautions that need to be taken is to ensure that people who start to have certain early symptoms of what might be a clot either in the brain, in the abdominal tract, or elsewhere, know what are the signs and go to a health facility that is capable of picking this up and treating those people. Our main interest is to make sure that people don't lose their lives due to this vaccination.
Sorry, I was muted. Thank you very much, Dr. Moeti. I have a question from Sarah. Dr. Yahyan, Sarah Gerving with DEVEX. Dr. Yahyan, how many people in Morocco have been fully vaccinated with both doses? Dr. Yahyan?
Merci. Oui, merci beaucoup. Alors, jusqu'au 7/4/2021, c'est-à-dire à la date d'hier, la première dose, le nombre de personnes vaccinées bénéficiaires est de 4 410 023. Et la deuxième dose, c'est 4 038 083. Donc, au bout de ces 10 semaines, on est presque vers l'immunisation complète de 4 millions, plus de 4 250 000.
Parfait, 450 000, bravo. Let's turn to Paul Paul from the Lancet. Are you online? Paul, the Lancet.
Hello.
Paul,
Yeah.
You have the floor. Vous avez la parole.
Thank you very much for this opportunity. So I'd like to ask Dr. Moeti, what is the WHO's official position on the issue of vaccine passports and on travel bans that are targeting some African countries by Western countries? Thank you very much.
Okay, thank you very much. I think WHO is in agreement with documenting those that have been vaccinated, so for public health data and management purposes. So it's important to know who has received the first vaccine, who has, and be able to recall them with a date to come back for the second vaccine and to know those people that have been vaccinated. This is important. But we are concerned about the possible, if you like, further driving of inequity in terms of the use and application of vaccine passports to determine travel and entry into countries. As part of the international health regulations, WHO recommends that this only be done in relation to vaccines that are widely and equitably available across countries. This is manifestly not yet the situation with the COVID-19 vaccination. So we would like to encourage that the imposition of vaccine passports as a condition for people to gain entry into countries not be applied, while we work together at the global level, as I said in my previous intervention, around the solidarity, ensuring that we catch up as soon as possible in those areas where vaccination has not been accessed. By the way, I'd like to correct what I possibly might have missaid, that Africa so far has only administered to people 2% of the vaccines that have been administered globally. So we can see that this would be of great significance to African people being able to move around. So we encourage countries to use vaccine passports for their internal purposes in terms of documentation, and we recommend strongly that they not be used in terms of determining international travel, while we work with our partners, with ICAO and others, to support the safe and documented travel in terms of testing the COVID status of people in the work that we've been doing to support cross-border minimization of transmission of the virus.
Thank you very much, Dr. Moeti. I have a question from Christine Okello, RFI, that I will ask in French. Je voudrais revenir sur les campagnes de vaccination en Afrique. Et c'est une question qui s'adresse à Monsieur Fall. Alors, je voudrais savoir où est-ce qu'on en est. Le directeur de Africa CDC, John Nkengasong, ce matin a donné une conférence dans laquelle il a fustigé la méfiance de certains Africains vis-à-vis des vaccins. Et il a souligné l'importance de lutter contre la désinformation sur les vaccins. Où est-ce qu'on en est, Monsieur Fall?
Merci beaucoup. Peut-être que cette fois-ci, je peux me permettre de répondre en français et dire que, comme je l'ai dit tout à l'heure, la vaccination à travers la facilité COVAX est en train d'arriver sur pratiquement la totalité des pays. J'ai donné tout à l'heure des statistiques en ce qui concerne l'Afrique de l'Est et l'Afrique australe, où j'ai indiqué qu'à peu près sur 21 pays qui sont couverts à partir de notre bureau régional, nous avons à peu près une quinzaine qui ont reçu le vaccin, à travers 12-13 sur le COVAX Facility, mais d'autres aussi ont pu, à travers des accords bilatéraux, obtenir ces vaccins. Comme je l'ai dit tout à l'heure, et je crois que Dr. John de CDC Africa a eu une déclaration assez importante, le problème de la vaccination, ce n'est pas seulement de les faire arriver dans les pays ou de les commander ou de les transporter, mais le but ultime, c'est de les avoir administrés aux gens qui en ont besoin, suivant la catégorisation qui a été mise dans les plans nationaux. Et de ce point de vue, le processus est en train de se dérouler. Bien sûr qu'il y a quelquefois des problèmes liés au coût opérationnel, liés au mouvement de la capitale vers les zones les plus reculées, liées, par exemple, quelquefois à des problèmes de logistique ou même quelquefois à des problèmes d'accès qui sont soit liés aux conditions physiques du territoire ou qui sont liés quelquefois à l'insécurité liée à la possibilité qu'il y ait des conflits. Mais indépendamment de ces défis-là, on rencontre un défi important qui est l'hésitation, qui repose sur les rumeurs et la désinformation qui, quelquefois, accompagnent cette vaccination-là. Mais comme j'ai dit tout à l'heure, ce n'est pas une première. On l'a expérimenté dans les grandes campagnes de vaccination qui ont permis de sauver des millions de vies d'enfants. Et à travers toutes ces campagnes-là, on a vu que quelquefois la désinformation, quelquefois les rumeurs, quelquefois les hésitations peuvent être des obstacles. Et c'est sur cela que nous sommes en train de travailler. Notre travail consiste à plusieurs points. Premièrement, faire des études de comportement et comprendre réellement quels sont les obstacles et quels sont les aspects de la désinformation qui impactent le plus sur les gens et qui les empêchent d'accepter la vaccination. La deuxième chose, c'est aussi s'assurer que la bonne information, les bonnes données, les bonnes informations scientifiques, comme vient de le dire tout de suite le docteur Moïti, sont à la disposition des gens. Quelqu'un peut entendre que oui, Astrazeneca entraîne des caillots sanguins et puis on généralise ça. Mais quand les gens ont la bonne information pour montrer que la proportion de personnes qui ont ces effets-là est extrêmement infinitésimale, extrêmement réduite par rapport à la tendance globale, cela peut entraîner aussi un changement. Mais plus que les études et les données sur les informations à véhiculer, ce que nous cherchons à faire aussi, c'est faire des partenariats très larges avec les personnes dont les voix portent. Vous avez dû voir hier, à travers la campagne, à travers la Journée mondiale de la santé, beaucoup de personnalités, y compris une ambassadrice de bonne volonté de l'Unicef, Angélique Kidjo, a été largement diffusée dans les médias, indiquant combien pendant son enfance la vaccination l'a sauvée et lui a permis d'être ce qu'elle est devenue aujourd'hui. Ce sont des porteurs de voix. Ça peut être des chefs religieux. J'ai donné mon expérience quand j'étais représentant au Nigeria, comment les émirs, les sultans, les autorités dont la voix porte ont été utilisées. On a vu aussi dans beaucoup de pays les présidents de la République, les autorités, les officiels se mettre au devant, prendre les vaccins pour rassurer la population de toute la sécurité qu'il y a autour de ces vaccins. Ce sont des éléments qu'il faut mettre ensemble. Ce sont des campagnes qu'il faut enclencher et leur donner la même importance que la disponibilité du vaccin. Et comme je l'ai dit, basé sur l'expérience que nous avons en Afrique, la vaccination n'est pas quelque chose de nouveau en Afrique. S'il y a un continent qui est prêt pour COVAX, c'est vraiment l'Afrique, parce qu'on est dans ça depuis longtemps. Les agences comme l'Unicef, c'est pratiquement leur essence ou leur âme, c'est vraiment la vaccination. Il faudrait donc que aussi nous tous, on s'y mette pour adresser, pour s'attaquer à cette désinformation, s'attaquer à ces hésitations, s'attaquer à ces rumeurs. Et c'est ce qu'on est en train de voir dans les pays. Et plus le travail s'amplifie, plus on a un degré d'acceptance et un degré d'adhésion qui fait qu'on a des bons chiffres comme on vient de le voir au Maroc, au Rwanda ou en Angola et dans d'autres pays qu'on aurait pu citer qui sont en train de bien dérouler leur campagne vaccinale.
Merci infiniment, Monsieur Fall. Et je vais me tourner vers Dr. Moeti. Dr. Moeti, we can see that the new Tanzania president is going to appoint a panel of experts to advise her on how best to curb the spread of the coronavirus. How is WHO working with this government to assist in this panel of experts?
Yes, thank you. I mean, first of all, we welcome very sincerely this initiative by the new president of Tanzania and we welcome the statements that she has made to the population as well and ensure that people accept that the virus is circulating in Tanzania and is seeking to understand better the situation of the country in relation to what is happening to the rest of the continent. As WHO, we've worked consistently with Tanzania in anything that the country was prepared to do, able to do in response to the COVID-19 pandemic, right from the very beginning. We supported a lot the preparedness activities in Tanzania. early on and have continued to work with them, to dialogue with them, and to indicate and express strongly our readiness with our country team, because we have a team led by WHO representative working in Tanzania on a day-to-day basis with the ministry. For sure, when we hear about the expert group that has been put in place, we will reach out and offer our own expertise, both within our country team at the regional level and even at the global level, to join with Tanzania to analyze their situation. And we will as well continue to offer the country our support in terms of working to have access to COVID-19 vaccines for the population of Tanzania. So this is a very welcome development in the country, and we are ready to work with other partners to support the president, the Minister of Health, and their team in working through this situation.
Thank you, Dr. Moeti, for this answer. Let's now turn to Lisa Schlein from Voice of America. Are you on the call?
Yes. Hello. Nice to see you all. Dr. Moeti, I have a couple of questions for you. First, I'm wondering how much of a setback would it be for Africa if you did not use Astrazeneca, if there was so much hesitancy on the part of people that they lost confidence, and would the other vaccines be able to replace AstraZeneca, or would there simply not be sufficient amounts available? And also, how many of the people who have had blood clots actually died? Nobody seems to mention that. And then the second question is, you appear to indicate that the rollout is going slower than you had anticipated, at least the last press conference I attended a couple of weeks ago. Everyone seemed to be a little bit more upbeat about about receiving the vaccines and getting the doses into people's arms. And I think the anticipation was that perhaps you could do a great deal by the middle of next year. When do you think you will be able to vaccinate most people? Thank you.
Thank you. Maybe Richard can also add later on.
I think I'll just start and then hand it over to Richard to respond in more detail. I mean, certainly, you know, speaking from the perspective of the COVAX facility, we are working and we're in communication with the manufacturers of a range of vaccines, not only the AstraZeneca vaccine, but for the moment, this is the vaccine that is most available to this platform that has been established in a multilateral way by multilateral agencies, including ourselves, Gavi and others, governments, African and other low and middle income countries, and also upper middle income countries supporting. So for this mechanism and platform, the AstraZeneca is a vaccine that is currently the most available. But we are clearly looking at the possibility of other vaccines as well. And therefore would be now studying the situation in relation to any challenges with AstraZeneca vaccine in terms of what could be the other options. I'll hand over to Richard now to provide the rest of the response to these questions.
Yeah, thank you, Dr. Moeti, and good afternoon, colleagues. I think just to add a small clarification on what Dr. Moeti has very well explained, the COVAX facility since the beginning had a much larger portfolio of vaccine that were targeted. So the AstraZeneca is not the only vaccine that is so far being targeted. It's for the moment the one that is very much available, but there are additional vaccines. They become available, receive the EUL by WHO, will also be, of course, included in the portfolio of vaccines that are available through COVAX and will be definitely offered to the countries. But it's very important to mention that the AstraZeneca vaccine remain very safe vaccine. And I think most of the people spoke up before me have reaffirmed that. And so far, we have seen quite a very good uptake in many countries in the region. So we are looking forward for the additional vaccines. We have talked about the Johnson & Johnson that have received the WHO emergency use authorization. But unfortunately, as we know, this is a vaccine that is still in a very limited quantity. But also we are looking at the Novavax vaccine, hopefully with a closer authorization in the coming month. But it's important also to mention that there are a few countries in the region that have started to use the Pfizer vaccine through the COVAX facility. So a broad range of vaccine in the portfolio of COVAX. Now, with regards to the number of cases which have been related to some of these thrombotic events, it's very important here to mention that with the surveillance system that have been established in many countries of our region, which have been strengthened before the deployment of the vaccine, we have not yet so far recorded cases related to thrombotic events. And even in a country like Morocco that has immunized millions of people with the vaccine, we have not as well have a confirmation of that. So this is rather a very good news where we need absolutely to strengthen our pharmacovigilance and safety monitoring system in the different countries. And then finally, in terms of the case that have been fatal with the thrombotic event, I think for the data that was released by the EMEA, out of the 25 million of doses that have been administered, and this is based on the statement that was done yesterday by EMEA, 86 cases were recorded out of the 25 million, and out of these 18 were fatal cases. But again, it's very important here to continue to reaffirm that, and WHO yesterday released a statement by the Global Advisory Committee on Vaccine Safety that more studies are really necessary to try to understand what is going on. And we are supporting at WHO country really in this region to make sure that their pharmacovigilance system is up and running and can give us any suspect event that could be detected. Thank you.
Merci, docteur Mihigo. Je me tourne vers le docteur Yahyan. C'est une question de Hayat Garbaoui de Média 24 du Maroc. Docteur, où en sont les procédures administratives nécessaires pour que le Maroc reçoive l'allocation COVAX? Il y a une question de suivi qui est la première attribution pour le Maroc était de 1,6 million de doses qui sera livrée en plusieurs lots. Est-ce qu'on connaît la quantité du premier lot qui est attendu et a-t-on une idée des dates de livraison?
Merci pour Média 24. Effectivement, les négociations sont en cours. Le Maroc a souscrit aux facilités COVAX. Il va recevoir lui aussi une quantité de vaccins. Et comme je l'ai dit, les négociations sont en cours. Il est prématuré de parler du nombre de doses et éventuellement les dates d'arrivage. Tout cela est inclus dans la négociation. Ce qui est sûr, c'est que la négociation est positive et comme tous les pays du monde qui ont souscrit à la facilité COVAX, le Maroc va recevoir prochainement un certain nombre de doses qui étaient allouées au pays.
Merci infiniment, Dr Yahyan. Monsieur Fall, j'ai une question de Emmanuel de NHK. In addition to the vaccine acquisition challenges, are you able to address also the syringe shortage crisis apparently there is also a shortage of syringes. Mr. Fall.
Thank you very much, Elizabeth. Yes, it's true that I have focused so much on the challenges related to misinformation and related to hesitancies. But as I say, you know, the vaccine delivery goes through a chain with a large number of steps and large number of components. Let's not forget that in the context of this COVID, from the onset to today, the impact has been seen throughout all aspects of life and production. The procurement, the productions, the delivery has been shaken in many times and many respects. And as you know, syringes and the disposal box also are very important component in the operation. We are facing here and there sometimes challenges in the production, challenges in the distribution, but I'm hopeful that most of those challenges will be addressed moving forward. As you can see in the first wave and the first allocation of vaccines, the vaccines were preceded in all countries by these tools like syringes and these disposal boxes. And I believe that in the current rollout, countries are using the stock that they have, but moving forward, we need to multiply effort and make sure that wherever these shortage are, they will be addressed, but to make it possible that by the time of the second wave and the second allocation arrive, we will have enough and sufficient quantity of syringes and any other tools that are needed for the proper rollout of the vaccination program at country, at national and subnational level. We are mindful of some of those difficulties, but we do have a massive unit in our organization, which is supply division, which I mentioned earlier, deals with over 2.3 billion doses of vaccine prior to COVID. And now with COVID, we have stepped up and stretched our capacity to be able to face the new challenge. As part of also their work, it is also to test the market, to make sure that the procurement of any other tools that are needed are there, to make sure that the transportation line are in place, and to make sure that all the delivery will be met or delivery will be done on time. That's what I can say for the moment. If there is any specific question or follow-up in one specific case of countries, we can follow it up. But for the moment, maybe let me just stop there. Back to you, Elizabeth.
Merci. Thank you very much, Dr. Fall. I have a question for Dr. Moeti from Alicia Mihami for Allo Doctor Africa. Dr. Moeti, are you worried that India's decision to slow down exportation of Astrazeneca vaccines will affect the vaccination campaigns across the continent?
Yes, I mean, there is no doubt that the scheduling of deliveries, the volumes that are being delivered has been affected by this decision by the Indian government, which, as I said in my opening statement, is related to their observed second wave of cases, which is evolving very fast. And you know, we need to remember that India is a country with a very big population, and India is a country that is acting, if you like, as the production facility for much of the world as far as vaccine is concerned. But certainly, we are observing that this is producing a delivery speed slower than had initially been anticipated as we were planning with countries, and we are now advising our countries as soon as we have the more accurate information to enable them then to prepare and to plan, so that by the time they receive the vaccines, it's very clear that those people that receive the first dose will then be targeted to receive the second dose, and also the additional people that will be added among those that have been vaccinated. In a way, as I said, we didn't elaborate very much on some of the challenges and the lessons that we are learning in the delivery of the vaccines. There are areas that need to be improved. Not that I'm saying that it's good to have this delay, but it gives the opportunity then to take those lessons on board and improve and refine the preparation for the even more efficient and effective delivery to people of the next vaccine supplies that our countries are going to be receiving.
Thank you very much, Dr. Moeti. I have a very interesting question for Dr. Mihigo here from Ezewike from News Central TV in Nigeria. Dr. Mihigo, why has Africa not developed its own vaccine yet? Don't you think that a homegrown vaccine will help dispel talks about stopping Africa's population growth, etc.? Don't you think so, Dr. Mihigo?
Yeah, thank you, Elizabeth, and thanks for the question from the journalist from Nigeria. Well, I think we definitely welcome, and WHO do support local vaccine manufacturing capacity in Africa. Minister of Health gathered in Addis Ababa in 2016 during the first ministerial conference on immunization that was convened by WHO and the African Union, concluded that the local vaccine production capacity in Africa is one of the 10 commitments, should be the priority. But we know that this is something that may take time to get to a capacity for production, though we do have a few countries in the region, Senegal, Egypt, to some extent South Africa, which are producing some vaccine on the continent, either from the bulk or in the fill and finish capacity. The other thing I would like to add here is a vaccine being produced in Africa or elsewhere. I think what is really very important is to look at the safety and efficacy of the product. Indeed, if this can be done in the region, I think we will all welcome that. And there is now, with this pandemic, COVID-19 pandemic, a renewed emphasis, both at the political level, but also at the scientific level, to try to fast track the local vaccine production. But until then, most of the vaccines that are really are going through WHO pre-qualification are judged to be of very high quality and safe, and can be rolled out in our country without really any problem. Thank you.
Thank you very much, Dr. Mihigo. Another question.
I can add something here, Elizabeth, if you permit, to the question, why does Africa develop our own vaccines? People believe in them more. I think we would very much like to encourage this, of course, and we know that we do have scientists in Africa. We have scientists that are working collaboratively internationally. But to develop a vaccine is a partnership not only between scientists and government. It also needs investments from private pharmaceutical companies and others, and it needs a clear indication of a market. Clearly, for the vaccines that we are talking about in this pandemic, the market is certainly there. But in the interim, what we'd like to encourage as well is African countries' involvement in some of the international trials of vaccines that are currently ongoing, including those that around the COVID-19, so that we have the opportunity for the vaccines to be tried in African populations, in African context, and we can learn then directly about the efficacy and other issues around these vaccines in Africa. So this, in relation to the vaccine development for this time, could have been better. So we would like, as WHO, we are advocating for this, and we would like to continue to encourage the involvement of African countries in the multilateral vaccine trials that are going on, some of which are being coordinated by WHO.
Thank you very much, Dr. Moeti. I think we have Anne. Anne, are you on the call?
Yeah, hi, thanks very much. My name is Anne Gulland. I'm from the Telegraph in London. I would just like to ask about the decision by the African Union to stop to not take the vaccines from the Serum Institute of India and instead to focus on the Johnson & Johnson vaccines. I just wondered why that decision was taken. Was that because of the problems with supply in India, or was it because of the link with the blood clots? I just wondered if you have any insight into that. Thank you.
Okay, thank you for that question. This decision was reached in discussion between the African Union and the COVAX platform, including WHO, simply because we are aiming to procure vaccines ultimately for the same countries and the same populations. And with this diversifying potential sources and vaccines is to ensure that we are not, in a way, competing and stepping over each other, looking for the same vaccine. So it is to work in a complementary way. I'm very much assured that it is not to do with doubts about the safety and other considerations of the Astrazeneca vaccines. It's simply to recognize that there are challenges in the volumes that are available, in the production capacity globally, and to expand where we are looking, because at the end of the day, we're looking for vaccines, as far as the African Union is concerned, to provide to African countries and African populations, both from the COVAX and from the AVAT and the mechanism that the African Union is running.
Thank you, Dr. Moeti. I have here a question to Mr. Fall from Esther Nakazi, who's a freelance journalist. And Esther is asking, in light of the logistical and distribution challenges that countries are facing, don't we risk to have vaccines expire in Africa? And do we know what is the wastage level? Mr. Fall.
Thank you very much. Let me come back on this because, as I say, the challenge is of several fold when it comes to the rolling out of the vaccination program. We do know that transporting it to the countries is followed by some of the challenge to reach the last mile. And as you know, most of the targets are not only located in the capital city. And together with that, we have also issues related to not only transportation, but transportation in the required conditions, which is the cold chain. We have a vaccine readiness assessment tool that we are using to measure to which extent the countries are able to face those challenges that are linked to the transportation, to the conservation, to the administration, and the proper management even of the vials, so that when you open one vials, you use the required number of doses and you don't need to return or to waste those doses. I think, as Dr. Moeti was saying in the beginning, beside the logistic architecture, you need to look at also the planning and the organization of the vaccination campaign. Here where I'm in Nairobi, I happened to visit one or two centers where vaccination was taking place, had a short conversation with the nurses and the health workers who were administrating, and they had a very rigorous way of managing the planning, the organization, and the distribution to avoid that a vial which is open are left with doses that are unused. And so far, what we have seen is both in the transportation, in the cold chain for the conversation, in the planning and the organization of the vaccination session, things are working smoothly, and we are not facing yet any critical issue of wasting doses or returning doses that are unused that could be linked to the micro-planning. I think this is one of the challenges also that we have to face, so that when we address the multiple issues that we have, each one of us also work. I know our colleagues with WHO tirelessly work with the Ministry of Health, with team, to make sure that all this organization and planning are done in a way that can anticipate and that can help to address those issues. And as I can see, out of the 14 countries that are under our portfolio here, we haven't seen any critical issues of cold chain. And by the way, if Pfizer have been distributed only to 4 countries out of the 21 in our region, it is because some of the countries who even wanted Pfizer could not meet the requirement in terms of cold chain. Luckily, Astrazeneca is adapted to the cold chain we have. We are helping also to ramp up the capacity in terms of cold chain for the next doses, because let's not forget that what we have received in the first wave of allocation is not what countries are expecting. In the first rollout, it's now being properly managed, but moving forward also we need to help through Gavi facilities and through other facilities, help countries to ramp up their cold chain and be able to manage the increased number of doses that they are getting in the weeks and the months to come. But all of this will be supported also by a micro planning and an organization which will help to plan so well this session of vaccination to the point that the risk of wasting or losing doses will be minimized to the possible extent. Back to you, Elizabeth.
Thank you very much, Mr. Fall. We are coming to the end of this virtual press conference. Let's turn to our 3 panelists and ask them if they have final messages. And you have 1 minute each because we've already reached the time limit. May I start with maybe Dr. Yahya?
Merci Madame la modératrice. Je suis très content de participer à cette conférence de presse virtuelle. Aujourd'hui, le défi, c'est continuer les progrès, continuer à vacciner. Il faut se préparer, il faut préparer la chaîne de froid. Il faut être très vigilant et surtout, il faut conserver les mesures barrières qui restent des déterminants aussi pour stopper la circulation du virus. Merci.
Absolument. Continuons à observer les gestes barrières. Monsieur Fall.
Thank you so much, Elizabeth. I wanted maybe just to share a few words, again, to reiterate the thanks to my sister, Dr. Moiti, but at the same time to all the journalists who participate and how they can help us to amplify and expand some of the messages. My specific message will be a sense of optimism and a sense of hope. We are not yet where we want to be in terms of equity of vaccines, but having seen how the COVAX start rolling out and reaching close to 100 countries in few days is an indication that international solidarity is there. And let's not forget that in the beginning of the pandemic, everyone, and the biggest fear was that everyone go back and look inward into its own boundary, its own territory. But we are seeing a revitalization of international solidarity. The second notion of hope and optimism is that vaccines is not new to our continent. I have mentioned earlier how it has been instrumental to increase and improve child survival, save millions of children's lives just by the simple fact of immunization. I am having the same hope that all the lessons we have learned, all the lessons we have taken from the past would help us to address the challenge that we are facing today in the rollout of the COVAX. Lastly, next to any challenges, you have an opportunity. And I think if there is any opportunity we can take away from this pandemic and from this crisis, is, as Moiti was saying, to renew our commitment to reinvest and reinforce the health system. COVID-19 is just one outbreak, one pandemic. Who knows how many are lying ahead of us? We had before COVID-19, Ebola, any other, and many others public health challenges. How this challenging time help us as a humanity to learn and make sure that we can carry forward those learning and make our health system, our community, and our people better prepared for upcoming challenges and challenges that was here also prior to the COVID. Sorry to be a bit long, it was a bit more than 1 minute, but those are just the notion and sense of hope I wanted to share here in the end of this forum. Back to you, Elizabeth.
Thank you very much, Mr. Fad, for this inspiring and optimistic words. We'll turn to Dr. Moeti for the final word. Thank you.
Yes, thank you very much. First, I'd like to thank my fellow panelists, Dr. Yayan and my brother Mohammed, very much for having joined us, and also thank our media colleagues for the work that you are doing to spread information around to populations. And then secondly, I would also like to add that word of advocacy to our partners who have acquired some vaccine supplies. Acknowledging the challenge, you know, I see every day what is happening in the wealthier countries, people demonstrating, they are fed up of the lockdown measures. We are seeing cases going up. So it is a challenging situation at the global level, but still just to add that word of advocacy for the sharing and a word of thanks for the financing that has already been provided by the wealthier countries. And then finally, I would also like to add, and very much on an optimistic note, to say that the enthusiasm with which the vaccines were received by our national leaders, by the healthcare workers on the African continent, that has, when it's been available, has been of great encouragement to me and to my team in WHO, that we are on the correct path. And I'd just like to end by urging all of us as individuals in our families, in our communities, you know, if you are a healthcare worker, if you're in the priority group of people of my age with hypertension, please come forward. You are the ones that we are prioritizing in order to minimize the negative impact in terms of death and devastation of our healthcare systems of the pandemic. And then please let's spread the correct information in our neighborhoods. If you're a young person, you are learning, you are on the internet, getting the right information, spread it in your family, spread it to your teachers, other people that you're in touch with. And I'd like to end also where Dr. Yayan ended. We, at the end of the day, have to continue as individuals and family members with the public health measures, wearing our masks, keeping our distancings, the hygiene measures, not gathering where it's not necessary, and then waiting and taking our turn to get the vaccine when it becomes available. Thank you very much. That's where I'd like to end.
Thank you very, very much, Dr. Moeti, for these words that are inspiring and full of hope. This is the end of our press conference. I would just like to thank all the panelists for the time and inform the journalists that the session continues with French questions with Dr. Minigo. So those who have questions in French only can stay after this session. And for the other panelists, I wish you a very nice day in your respective countries. Thank you, Dr. Moeti. Thank you, Dr. Fall. Thank you, Mr. Fall and Dr. Yahya. It was an honor to moderate this session. All the best to all of you. Bye.
Thank you. Bye.
Merci beaucoup.
Merci.
Au revoir.
Au revoir.
Bonjour à tous. Je suis Vincent Defay du bureau régional de l'OMS pour l'Afrique. Nous avons donc un petit peu de temps devant nous pour poser les questions en français qui n'ont pas été répondues. Avec nous pour y répondre, Dr Mihigo, comme maintenant toutes les semaines. Dr Mihigo, vous avez longuement parlé là, des questions de sûreté du vaccin Astrazeneca en anglais. Et visiblement, il va être nécessaire d'y revenir en français. J'ai beaucoup de questions sur le sujet. Est-ce que tous les effets secondaires ont été répertoriés? Et surtout, que faire des risques qui ont été évoqués au regard des bénéfices de ce vaccin?
Ok, merci beaucoup. Effectivement, je voudrais d'abord commencer par peut-être décrire ce que nous avons pu mettre en place avant même l'arrivée des vaccins. Tous les pays ont été fortement appuyés par l'Organisation mondiale de la santé pour essayer de mettre en place un système de surveillance des effets post-vaccinal, mais également ce que nous appelons une pharmacovigilance accrue pour être sûr que un effet secondaire qui n'a pas pu être détecté lors des essais cliniques puisse éventuellement être détecté lorsque le vaccin est mis en œuvre. Alors, lorsque les tout premiers vaccins ont été délivrés au niveau des pays, et il ne s'agit pas uniquement des vaccins Astrazeneca, mais également de tous les autres types de vaccins, que ce soit autorisés ou pas par l'OMS, nous avons encouragé les pays à renforcer leur système de surveillance pour être sûr que nous puissions être capables de détecter les cas. Et je suis content de dire que nous avons maintenant dans la plupart des pays un système qui marche, qui rapporte des cas et Dieu merci, la majorité des cas qui ont été jusque-là rapportés sont des cas mineurs qui disparaissent dans les 24 à 48 heures, une petite fièvre, une douleur au lieu d'injection, etc. Alors, pour revenir sur les effets secondaires d'AstraZeneca, effectivement, on a constaté un certain nombre d'effets thrombotiques liés à la coagulation sanguine qui sont, c'est vrai, rares, mais qui ont été signalés par-ci, par-là, et majoritairement dans les pays en Europe qui ont déployé ce vaccin. Que ce soit l'Agence européenne des médicaments, que ce soit l'Autorité nationale de réglementation en Grande-Bretagne, mais également le Comité consultatif mondial sur la sécurité des vaccins de l'OMS, se sont penchés sur ces cas pour essayer de voir est-ce que réellement tous ces cas étaient liés étroitement à l'administration de vaccins. Il est maintenant prouvé aujourd'hui que c'est difficile d'avoir, comment dirais-je, une situation de cause à effet, mais il a été clairement dit hier par l'Agence européenne des médicaments que les très rares cas qui ont été notifiés dans certains pays pourraient éventuellement être listés comme des effets secondaires possibles de ce vaccin. Alors, au niveau de l'OMS, nous appelons encore à la poursuite des études pour être sûr que nous puissions d'abord, avoir des informations en dehors de l'Europe, parce que, comme je l'ai dit, sur environ 200 millions de doses de l'AstraZeneca qui ont été jusque-là administrées, autour de 86 cas seulement ont été enregistrés. Et nous espérons que les pays africains, en Inde et ailleurs où le vaccin a été déployé, nous aurons également des informations qui vont soit valider ou invalider ce qui reste. Alors, en conclusion, nous pensons que lorsqu'on met ensemble les risques qui sont extrêmement rares, mais également les bénéfices potentiels conférés par ce vaccin, la réduction des cas sévères, la réduction des cas d'hospitalisation et la mortalité, les bénéfices sont réellement largement en faveur de la poursuite de la vaccination avec AstraZeneca. Et d'ailleurs, c'est ce que l'Agence européenne des médicaments, mais également l'OMS, continue de recommander au pays.
Merci beaucoup. La question suivante concerne le mécanisme COVAX, et en particulier le Burkina Faso, qui fait partie d'un des derniers pays africains à ne pas avoir reçu de vaccin via le mécanisme COVAX. Avez-vous plus d'informations sur le sujet? Est-ce qu'il est prévu une livraison prochainement?
Bon, effectivement, nous suivons de près, extrêmement attentivement, la situation au Burkina Faso. Le Burkina reste malheureusement un des seuls pays en Afrique de l'Ouest à n'avoir pas adhéré à l'initiative COVAX, n'ayant pas encore rempli ou signé tous les documents nécessaires à rejoindre l'initiative. Notre bureau au niveau de Burkina Faso, mais également nous ici au niveau du bureau régional et au niveau global, continuons à travailler avec les autorités nationales pour éventuellement essayer de les aider à mieux naviguer cette situation, à comprendre leurs réticences et éventuellement comment les appuyer pour aller de l'avant. Donc, pour le moment, c'est ce que je peux dire. Nous avons espoir qu'effectivement, cela va se régler dans les jours à venir et que, effectivement, le Burkina pourra éventuellement également bénéficier des vaccins et ainsi protéger les populations qui en ont besoin.
Alors, toujours à propos de COVAX, une question de Express du Maroc. Le COVAX est présenté comme un instrument visant à aider les pays pauvres à vacciner leur population. Comment expliquer donc la présence de pays comme la Corée du Sud ou du Canada parmi dans ce mécanisme?
Je voudrais remercier le journaliste ou la journaliste qui a demandé cette question parce qu'effectivement, nous avons des fois des petites confusions sur la philosophie qui est derrière COVAX. Il faut préciser que l'initiative COVAX ou la facilité COVAX a été mise en place pour assurer une certaine solidarité globale. L'objectif étant que la majorité des pays puissent se mettre ensemble pour avoir une force de négociation commune et ainsi influer sur le marché des vaccins. Parce que lorsque vous avez des achats groupés, la possibilité d'avoir des prix réduits devient importante. Donc, sur les 190 pays, parce que nous avons aujourd'hui 190 pays qui ont adhéré à l'initiative COVAX, ils ont été divisés en deux catégories. La catégorie de ce que nous appelons les pays qui peuvent financer eux-mêmes les vaccins et la catégorie des pays qui peuvent être appuyés, et notamment c'est la deuxième catégorie des pays jugés moins avancés qui peuvent bénéficier des subsides de COVAX. Donc, ce mécanisme est un mécanisme un peu hybride qui met en place non seulement les pays qui peuvent acheter les vaccins eux-mêmes et les pays qui, avec l'appui de l'aide internationale, vont bénéficier de ces vaccins. Donc, ce n'est pas une aberration de voir des pays à revenus élevés faire partie de COVAX, parce que lorsque nous regroupons les achats en même temps, on a abouti à avoir des prix extrêmement compétitifs par rapport aux pays qui ont fait de négociations bilatérales avec les fabricants de vaccins. Donc, c'est important de souligner cet aspect de solidarité et ceux qui peuvent payer le plus ont également mis de l'argent de côté pour favoriser à ce que les pays qui n'en ont pas les moyens, les pays les moins avancés ou les moins développés, puissent recevoir les vaccins de manière gratuite. Donc, il n'y a pas un antagonisme entre les deux, c'est plutôt un acte de solidarité, mais malheureusement, nous avons vu que certains des pays qui font partie de COVAX avaient également mis en place des mécanismes bilatéraux pour acheter des vaccins, et c'est ça que nous appelons à ce que les pays qui ont pu faire des précommandes puissent partager ces doses avec COVAX afin que les pays moins avancés ou pauvres puissent en bénéficier également.
Alors, toujours à propos de la vaccination contre la Covid en Afrique, une question de RFI. Quels sont les principaux obstacles à la vaccination sur le continent? S'agit-il de la méfiance des populations ou du manque de vaccins? Et surtout, comment répondre à ces défis?
C'est une question intéressante. Je crois qu'on l'a entendu ce matin dans la conférence de presse sur environ 690 millions de doses qui ont été administrées à travers le monde. Nous avons moins de 2%, autour de 30 millions, qui ont été délivrés en Afrique. Donc, nous avons un vrai problème de disponibilité de vaccins. Moins de 2% des doses qui sont disponibles au niveau global sont venues en Afrique. Donc, ça, c'est un gros problème, la disponibilité de vaccins. Et nous avons vu également que certains pays qui ont reçu les premières livraisons de COVAX ont pratiquement épuisé leurs doses parce qu'ils ont immédiatement vacciné. Et c'est le cas de pays comme le Ghana qui est pratiquement en cours de finir avec ses premières doses, le Rwanda, et d'autres pays qui n'ont plus de doses pour continuer la vaccination. Mais nous avons également un deuxième facteur, effectivement, que nous ne devrons pas négliger, c'est une certaine méfiance, et ça a été largement discuté dans la première partie de la conférence, sur certaines couches des populations par rapport à l'acceptation des vaccins. Je pense que ça, c'est un point vraiment important sur lequel nous devons tous travailler et voir dans quelle mesure les bonnes informations, les données évidentes qui sont basées sur la science et les données soient communiquées au pays afin effectivement d'aider les populations à prendre des décisions sur base d'informations vraies. Donc, c'est ces deux facteurs sur lesquels nous jouons, renforcer la disponibilité des vaccins au niveau des pays, mais également lutter contre la désinformation qui continue à circuler au niveau des différents pays.
Alors, justement, à propos de désinformation, nous avons une question de l'ORTN du Niger qui demande quels sont les moyens que l'OMS peut mettre à disposition des médias pour pouvoir sensibiliser et apporter un changement de comportement face à la pandémie en général et à la vaccination en particulier.
Ok, merci beaucoup. Je suis vraiment content de cette question. L'objectif, par exemple, de ces conférences hebdomadaires que l'OMS organise, c'est effectivement de vous donner, de créer une plateforme où nous pouvons partager, discuter des problèmes et des informations et vous donner l'information la plus vérifiée et à jour pour que vous puissiez également la répercuter au niveau de vos lecteurs ou auditeurs. Deuxièmement, nous essayons effectivement également de développer des outils et surtout des mises à jour réguliers. Je veux vous encourager à visiter notre site web sur Internet où nous essayons de mettre à jour les informations sur les vaccins, mais également sur la réponse à COVID de manière générale. Et enfin, on a créé une alliance contre la désinformation. C'est un partenariat non seulement de l'OMS, mais également avec beaucoup de partenaires, y compris l'Unicef, Africa CDC, le réseau des journalistes, pour essayer effectivement de voir et d'identifier les nouvelles qui circulent sur la toile, dans la presse, en termes de désinformation, et voir comment nous pouvons donner la bonne impression. Et pour illustrer cela, il y a la semaine passée, nous avons organisé le tout premier webinaire avec les influenceurs au niveau du continent africain, où plus de 200 influenceurs, que ce soit du monde francophone, anglophone, lusophone, ont été mis ensemble pour que nous puissions leur donner la bonne information et surtout demander leur appui pour utiliser les réseaux sociaux, utiliser la presse, les artistes, afin d'aider à propager la bonne nouvelle. Et je voudrais ici appeler les médias à nous accompagner dans cet exercice d'information de la population et surtout de dissémination des faits réels concernant les vaccins.
Merci. La dernière question nous vient encore du Burkina et concerne le Maroc, qui est donc le pays en Afrique qui a certainement le plus vacciné. Savez-vous si on voit déjà la courbe du nombre de cas infléchir, ainsi que le nombre de décès suite à cette vaccination massive?
Oui, absolument. Comme nous l'avons entendu ce matin et par rapport aux données que nous avons, le Maroc a déjà vacciné autour de 4 millions de personnes avec les 2 doses. Ils ont administré autour de 8 millions de doses jusque-là. C'est une avancée significative. Et lorsqu'on regarde la courbe épidémiologique du Maroc, effectivement, y compris les cas graves et le niveau des cas hospitalisés, on voit réellement déjà un premier effet vaccin sur les cas graves et les cas d'hospitalisation au Maroc. Et cela n'est pas nouveau. Nous avons vu dans tous les pays qui ont vacciné suffisamment leur population et surtout les personnes les plus vulnérables, les nombres de cas diminuent sensiblement, les nombres de cas graves et surtout les nombres d'hospitalisations et des décès chutent. Et c'est ça, effectivement, l'effet escompté des vaccins. Nous avons des données pratiquement spectaculaires qui nous viennent d'Israël, qui nous viennent d'autres pays, où on voit que, effectivement, la plupart des cas graves ont complètement été maîtrisés avec l'expansion de la vaccination. Donc, ce que nous demandons aujourd'hui à la communauté internationale, mais également au pays, c'est effectivement de nous aider en Afrique. On accélère effectivement cette livraison des vaccins pour qu'on puisse protéger les personnes les plus vulnérables. Nous avons eu plus de 115 000 décès, 115 000 morts l'année passée, jusque-là, de Covid. Donc, c'est des morts qui peuvent être évitées, c'est des morts qui peuvent être prévenues. Donc, si nous avons suffisamment de vaccins, si nous vaccinons rapidement la population, nous allons certainement sauver des vies, comme cela a été prouvé partout où la vaccination a été largement mise en œuvre.
Merci, docteur Meigo. Je propose d'en rester sur ces mots positifs. Merci à vous d'avoir répondu à toutes les questions. Merci aux journalistes d'être restés un peu plus longtemps et nous vous donnons rendez-vous la semaine prochaine pour une prochaine conférence de presse. Merci beaucoup à vous. Bonne journée.
Et merci, à la semaine prochaine.
Au revoir.